Себастьян Гітер, можна сказати, герой України. Тому що це єдина людина, яка, не дивлячись на те, що
Everything is good. You see me and you hear me now, yes?
І у 2014 році він один таки прилетів у Харків. Окей? You are ready?
Yeah, I'm ready. Okay, so thank you very much for the invitation to this Congress. And I give you all my respect to organize this, especially to my very close friend, Vladimir Rodchenko, in these critical times. So we're going to talk another time about hybrid surgery in the treatment of cervical disc diseases, especially of the double-level hybrid surgery. There is no conflicts in our disclosures. And first of all, when you think about hybrid surgery, we think about, is there any significance of adjacent level syndrome in the literature and in our experience? And you have numerous literatures about this. There is a significant adjacent level syndrome after 1 or 2 level cervical disc fusion. In the hybrid, in the literature itself, there's only a low number about special hybrid surgery. And this is very rare news. This is not very common, but we're going in for this. In our Matillion method, you see we're using for the hybrid, and in the past we're using the P cage, you see it in the middle on the right-hand side. And in our times now, since about 5 to 6 years, we're using the titanium cage from Esculap. It's a 3D printed titanium cage, and for the prosthesis we're using the ProDisc-Vivo. This is just an example. As a patient at the age of 45, we don't use these procedures in age more than 55, 60 because of bad bone quality. But you see here the disc herniation on the level 5-6 and at the level below 6-7 as well. And in 6-7 you have already some significant bony changes. We decide to do this hybrid solution by a fusion 6-7 and the ProDisc artificial in the level above. The operations we talk about were done between 2009 up to 2024, so we have a follow-up time of 1 to 15 years. And we're using in 150% double-level P cage standalone, and in another 150 we're going for the hybrid to compare disc groups, and the hybrids there were done by the C-space cage and as a P cage in the first years, and after 10 years we changed to the titanium solution, and in addition with the artificial disc. And we have a material method, age and gender. The relevant groups are between 30 and 50 up, and the most important levels are 5-6 and 6-7. And also a lower number in the level 4-5. We have a follow-up period of about 15 years. And you see when you look for the fusion rates in the cage level, you have a better fusion combined in the hybrid group. And the subsidence impact is also much lower in the hybrid group than in the standalone group. Afterwards, when you look at for post-operative pain in the first months after the surgery, you have a very lower number of adjacent facet-related pain in the hybrid group, a combination of fusion and artificial, compared to the standalone cages in 2 levels. When you look for the MAGNEP criteria from 6 to 15 years, you see there is a difference. This is not highly significant, but there is a difference of a better outcome and a better improvement in the group of cage in combination with artificial in 2-level surgeries. So the combination fusion and artificial disc is better than a double-level fusion. When you look for the NDI improvement from baseline, you see as well there is a difference. It's not a high difference, but there is a difference, especially when you're looking for the longer follow-up between 10 and 15 years, the group of hybrid surgery patients of this group, combination of cage and artificial, are complaining much less about facet pain and adjacent pain than the other group. When you look for complications, you find it typical after all these cervical procedures, dysphagia in 2 cases just temporarily, not permanently, temporarily. 2 cases in the standalone group and 4 cases in the artificial. Maybe it's related to the manipulation, a recurrence irritation, but palsy in the level 4-5 just temporarily. There were no bleeding or no progressive neurological deficit. So finally, the question was, is it possible to prevent, to avoid an adjacent level syndrome by implantation of an artificial disc compared to the double level fusion? The answer is yes. This is also literally proved. You have a significant lower interdiscal pressure in the adjacent levels after artificial disc implantation. One of the problems is the heterotopic ossification. Pseudarthrosis after artificial, yes, there is something like this. In the literature, it's described the rate between 2 up to 45%, in the middle of 28% in the first 3 years, and it's also a study proved by the FDA. They're talking about 15.6%. There are reports of more than 90% persistent movability after cervical artificial disc 2 years after operation, but there are also reports of less movability. In summary, finally, there is no highly significance of the advantage of TDI compared to diffusion, and there's no significance of persistent movability of an artificial disc implantation after long-term follow-up. In the consequence of our study observations, we changed from PEEK cages to titanium cages. We have a better fusion rate and we have a lower rate of pseudarthrosis. And we have also a much lower rate of impact and subsidence, and also a low rate of peri-implant ossification. So the reduction of platement rate comes down from more than 50%, then down to less than 5%. This is also an advantage of doing the hybrids. It is an option. It is expensive. We did now in our times only low numbers of this procedure because of the insurance and reimbursement problems of the hospitals. But if you have a 2-level pathology and a soft disc in the level above and more bony changes in the level below, this is a good idea, and it is mandatory to go for this hybrid surgery. Thank you very much.